Hello, everybody. My name is Tony Heil. I'm the Director of Communications and Public Policy here at ALS United Mid-Atlantic. And this is the ALS United Mid-Atlantic Goals podcast, where we talk to people about their connection to ALS, their perspective on the disease, and about supporting those living with the disease or caregivers and their families. Today, I'm going to be talking with my good friend, Alisa Brownlee. She has over 25 years of experience working here at ALS United Mid-Atlantic, where her role with assistive technology has expanded so much more than even her brilliant imagination could have imagined 25 years ago, because the technology and the resources have just evolved so much, and she has evolved with them. And she has been a resource not just here in the Philadelphia area for Pennsylvania, New Jersey, and Delaware, but helping people across the country to come up with new ideas, learn from them, and help countless families and people with ALS throughout those 25 plus years. Alisa, thank you so much for talking today.
Well, thank you very much for the invitation. I appreciate it.
So today we're going to be talking about home modifications. Before we do that, like I said, you've been here since, what year did you start here?
1996.
1996. So next year will be 30 years. A lot has changed since 1996.
Yeah.
The technology then was a 14.4K modem, right? So
Right.
the ability to do things was very different.
Absolutely. When it comes to assistive technology, now I started because I started not even in assistive technology. I started as a patient services administrator, but nobody was doing the augmentative communication program, and I took an immediate interest and kind of just grew from there. But so 1996, we're talking AAC devices, communication devices were not even using Windows. They were still in MS-DOS. And the synthesizer sounded like that. And an eye gaze system, which, we have a majority of our patients who need a communication device opt for an eye gaze. They were $30,000 then. So, and not covered under insurance. So we've come so far when it comes to communication. Unfortunately, when it comes to housing, not so much. So in the world, only 1.8% of homes, just a little over 1% of homes are built for accessibility, meaning they have no steps at the entrance, they are one floor, and they have an accessible bathroom. That's it. So the majority of us live in homes that were not made for wheelchair accessibility. And I started getting into the accessibility field, I want to say about 10 years ago, because I was seeing so many of our families make additions or modifications to their home, and sometimes they never got to use them. So I started this journey on educating myself about what options are there. And I'm still educating myself, still taking courses and classes because things change, obviously. But it's a significant barrier to the management of this disease when you don't have access to your home. And by me being able to provide, I do virtual assessments, and for me to be able to provide that guidance, whether or not you're newly diagnosed, mid-diagnosed, whatever, I always think it's good that somebody with ALS experience puts eyes on the house. And no person knows everything, okay? But when it comes to home care, the occupational or physical therapist in home care might have only experienced ALS maybe once in their career, whereas I do it 24/7, but you know what I mean. And I look at a house specifically through the lens of ALS. And I think that people need guidance on how to either make their home not only accessible, but we also talk about making it safe for both the caregiver and the person with ALS. I know it won't surprise you, Tony, but there is a peer-reviewed study that falls within the ALS community are 50% more detrimental than people without ALS.
And I had a friend who just fell this weekend or recently, who's perfectly reasonable health. She's 40 years old and just tripped on some stairs and that was significant. She didn't break anything, but just it was a lot of pain. My mother-in-law had a fall a few years ago, and she did not have ALS, but it was significant. And those are people without ALS, and so if
Right.
you have the conditions around our disease, I can only imagine that the implications are so much more severe.
Absolutely. And unfortunately, if you do break something and you have ALS, then you might be in the hospital for days on end. Then you might end up having to go to rehab. And so all those days that you laid in bed, you decompressed, you're not going to get back what you've lost. So we really focus about not only for home accessibility, but home safety. And I have a lot of people who say to me, "Well, they have ALS, and I go up the steps, and my caregiver walks behind me." Well, unfortunately, if you fall, you're taking them with you. So it really, I understand that making modifications to your home, your home is a personal area. It's almost sometimes a reflection of yourself. It's something that you saved hard for, or you work hard to pay the rent. I get it that people don't want to make changes. Um, However, if it keeps you safe and keeps you out of the hospital and keeps you out of a nursing home, then making small modifications um, is something that can keep you in the home. If that's your goal, to stay in your home, with this disease, the majority of people are going to have to do something to make the home safe and accessible.
So I know from my experience here and living with ALS in my family as well, most people who come to us did not have ALS in their family beforehand, right?
Correct.
It's 5 to 10% are considered of cases are considered familial. So when people come to you after a diagnosis or come to any of our care services staff, they don't know what they don't know. Not
Right.
because they're not smart, they're very smart people, but just you don't know what to expect with this disease from the earliest stages of diagnosis.
Correct. Correct. And you're right. They don't know what they don't know because nobody's planning on this.
Right.
Nobody's planning on having to get a wheelchair into their home that was built like mine in 1870 or a 1920s bungalow. You're just not planning that. Um, but what I can help with is that if you meet with me or any other professional, and I'm not saying this because it might be somewhere outside of the Mid-Atlantic region of somebody watching this, and they might have access to someone who does what I do, we can help you give give you tools so that you can make the best decision for you and your family. And I've had people say to me, "Should I move?" Well, that very personal decision. I get that. With today's housing market, and interest rates, people don't want to move. However, sometimes a home cannot be made accessible
Hmm.
without major construction. So that is a personal decision, but I have to tell you a quick story of somebody I was meeting with in New Hampshire, and they were right on the Canadian border, and they said, and literally their driveway was like this, right? They said, yeah, it gets to about minus 38 here in the winter, and I'm like, well, you're not getting up that driveway with ice in your wheelchair. They moved. So it's not only structural; it might be environmental, a decision why you might want to move.
And so, what is the first discussion you have about home modifications? It's not the first meeting. They don't come to their first clinic visit and then you come in and say, "Oh, you have a diagnosis. Let me tell you about your house."
Yeah,
Or do you tell them like within a week or a month? Or when does that discussion happen?
it it anytime, to be honest with you. My referrals come from our nurses, our social workers, sometimes families, sometimes a home-based therapist. Um, and it usually is triggered by something happening, a
Hmm.
fall, um, that they can't get up the steps anymore. My preference would be to do this as early as possible so that you can plan better. But oftentimes I get involved because there's been a triggering event.
Hmm.
Um, the majority of people need help with getting in and out of the house, with the second floor, because especially newer homes, they only have a powder room on the first floor, if they have anything. Um, So oftentimes the full bathroom's on the second floor, and then bathroom access. Those are the three areas that I focus on the most. So I have some beginning questions. I always say, is your goal to stay in your home? And then finding out if they own the home or is there a landlord. I think people are under the impression that landlords are required under the ADA to make their rental properties accessible, and that is simply not true. The ADA does not cover rental properties. Now, your state might have local or state guidelines, but in the state of Pennsylvania, what it says is that it can't, the modification cannot cause undue hardship to a landlord.
Mm-hmm.
Well, they can say, no, that ramp is going to cause me hardship, and say no. Um, the other thing I always ask is there a homeowners association? Because they are, again, not regulated by the ADA.
Mm-hmm.
Um, so they can say, no, you're not going to put a ramp on the front. No, we're not going to allow you to put a lift on your back porch. And they're within their legal rights to do so.
Mm-hmm.
So those are my initial questions. And then I kind of, it sort of grows generically through the visit. Let me see your home, let me see the doorway. I always ask people to have a tape measure, and I'll say, okay, how wide is that doorway? Can you measure the steps for me, so that I give them an idea, a general idea of a ramp, for example. So say in this country, a typical ramp is 7 3/4 inches. I don't know why, but that's the statistical average. But I always say, okay, take it at 7. When it comes to ramping, a lot of people don't understand that ramps are very expensive.
Yeah.
Very, very expensive. So ramps do have to be built to ADA guidelines. So what that means is for every inch of drop on your step, you need 1 foot of ramp. Okay. And in this country, statistically, 1 foot of ramp, 1 foot of ramp is $300.
Mm.
So you're talking thousands of dollars for a ramp. Now, we
Mm-hmm.
use, most of the time with ALS, people will be using steel or aluminum ramps because they're considered temporary. They don't need a permit. And they can go up in a matter of hours and down in a matter of hours. So that's the majority of people. They either rent or purchase them.
Now, I was talking with a legislator the other day, and they were very interested in understanding ALS and our services. And they asked, how big of a difference does it make to have an earlier diagnosis? Does having getting diagnosed faster, because I know a diagnosis for ALS can take a year or more, does getting into that and connecting with you sooner in an ALS diagnosis matter a lot to working on these home modifications?
Well, yes, I think so, especially if the goal is to stay at your home, and that if we identify your home is not accessible, that's going to mean construction.
Mm-hmm.
And I was speaking to a client with ALS on Friday. She called me and said, oh, they're getting their bathroom redone. It was 3 months of her living in a construction zone. And she's like, I'm so glad it's done, but we did it early. And that was the key. Because, again, their goal was to stay in the home too, but they didn't have a first floor bathroom. They had a curved staircase, and that's another problem.
Mm-hmm.
These newer homes, they love to put multiple curves on a staircase. Well, if you're thinking of a stair glide, that's going to be a custom stair glide. Anything that turns is custom. And they average anywhere from $10,000 to $15,000 for a stair glide, custom. So, um, so if somebody comes to me early enough, okay, so we might identify the house is not accessible, they might do construction, or they might move, and they're giving themselves enough lead time to
Mm-hmm.
find a place, to sell their place, to, if they need to mortgage. So, yeah, it gives them time to plan.
And I imagine some of your conversations are also you telling people you might not want to make this change because it could cost you thousands of dollars. We obviously provide a number of things like
Mhm.
ramping help and other services, but you may tell people, from my expertise, you may not want to do this major renovation because you may only need it for X number of months, and it would be easier for you to live on the first floor or something to those
Correct.
effect, right?
Correct. I will tell you the majority of people I work with do not do structural changes due
Hmm.
to the progressive nature of this disease, due to finances, because unfortunately, insurance does not consider access to your home or access to your bathroom a medical necessity. So everything that I talk about is personally raised funds, unless you have a fundraiser or a GoFundMe. So you're taking your savings or whatever you might have and applying it to construction where you're right, Tony, they might get only a few months out of it. The majority of people that I work with ought to make temporary changes, not structural changes.
And you also said you've learned a lot from going to trainings
Mhm.
and different certifications. Well, first, before I get into the next question, what kind of certifications have you gotten to assist people with? Like, just a couple ideas, like so people know that you didn't just read a Newsweek article. Like, what kind of
Yeah.
certifications does that mean?
I'm a certified aging in place specialist from the National Association of Home Builders. That's my CAPS. My CLIPP is certified living in place specialist. That is through the institute. Oh gosh, the Living at Home Institute. Sorry.
Mm-hmm.
And then my last one that I just got is from VGM Live at Home, and it's a mastery program. So I had to become certified in ramping, stair glides, bathroom modifications, structural modifications. So there were 6 different classes I had to pass to get to my mastery. So it's been an ongoing process, plus the fact that I go to at least 1 or 2 professional events every year
Mm-hmm.
to connect with my colleagues, to network, and to find new things.
And that's in addition to your regular work of
Sure.
visiting, being at the clinic, doing your regular home visits. It's a lot, and you have learned a lot from the ALS patients and caregivers as well, right? Like it's almost like you are a living AI bot in a way, with like because you're but as a human being, that's why humans are better than AI because with AI you type in information and kind of learns from it. But I'm sure you have learned so much from what's gone well and not well from other patients.
Absolutely. They are my best resource. When I say somebody says, Alisa, I tried this or I did that, I'm like, oh, that's genius.
Hmm.
Because although I've worked here for 29 years, I am not in the trenches that our families are. So whenever somebody shares information for me, I'll make a note and share it. The other source that I really get a lot of great information from is Facebook. And I know everybody sort of rolls their eyes about social media, but I think for this population, Facebook and the ALS pages have been able to make connections for the people that that never were possible before.
Hmm.
Unfortunately, the secondary problematic issue with this disease is that people get isolated.
Yeah.
It's so much trouble to get someone out the door, or they can't get out the door. And prior to social media, you might get an email from somebody. How did you meet people? You didn't when you were stuck at home. So
Right.
social media has allowed people with ALS to connect. There's some really good Facebook pages like ALS Patient and Caregiver. I think there's 30,000 people in that group, and there is not one day that somebody says, "This is my problem," that other people don't go, "Aha, I've got the answer for you." And
Yeah.
the same thing with home modifications. There's a home modification thread I follow. So I guess I'm constantly trying to keep up, especially like you just said with technology. I mean, it's it changes in 24 hours sometimes.
Yeah, and just so people know, you are also going to be speaking about this issue at our Help and Hope Symposium. We are bringing in another housing affordability expert, Kim Crowder, to join you on a panel to talk about this on Thursday, April 10th in King of Prussia, Pennsylvania. Details are at alsmidatlantic.org. You've done a lot of these professional conferences and as a speaker or as someone who learns from them. What do these kind of events do, like to coordinate and listen to other people and talk about it? What do you get out of them?
Well, networking, whether or not that's
Hmm.
with a colleague or a family with this
Yeah.
disease. Um, so the even I if they like so here's a great example, sorry. But so last year somebody came to me at Help and Hope and said, "Here's my problem. My loved one needs XYZ." And it was actually a communication app. And I downloaded it in front of her, showed her how to use it, though she went home and showed her loved one how to use it. So being able to even solve a problem when you're in front of somebody, sharing information, um, like speaking and giving people resources. And speaking of resources, I do want to point out that our website, under care services, we have great videos. It's called the AEC Corner. And as
Hmm.
part of that, there's a few videos on home modifications. But there's also videos for caregivers, like how to do a transfer and, picking out the right kind of walker and how to get in and out of the bathroom. So that's another great resource we just added to our website. Again, it's the AEC Corner. It's great.
Yeah, our website is full of important information. We're always trying to update it. So please, Alisa, I would encourage you to send me more information so we can update it. I know I'm always pestering you from the communication standpoint. One of the things that I think is important on our communication on our website is we have a new page called Meet the Care Services Team.
Mhm.
We want people to know that we have real people providing real help. You have about 30 years experience here. Other people on our care team have 10 or 20 or more years of experience, whether it's here or combined. And a lot of the folks here have a lot of longevity here, not just in healthcare in general. From your experience coming into people's homes, the vulnerable times with ALS, how important is it for them to know that they're talking to a real person who
Mhm.
lives in our area as opposed to just an AI chatbot or a website?
Absolutely. The personal connection is everything in terms of for families dealing with this, but for us too. You know, um, so whenever somebody is diagnosed in our region, you're going to be assigned a social worker. You will always have access to a nurse. We have a mental health nurse on staff, and you have access to me and any other professional that you need. So if you even call our general number, you might get a voice recording, but you're always going to get somebody to call you back. Uh,
Mm-hmm.
and especially if you're newly diagnosed, you don't want to just leave your name and number, and when you were diagnosed, we'll register you. Steve Spalding takes all of our new calls. He's our director of care services. So you will always get a human being when you're trying to register with us. And you will always get a human being when you need something.
Yeah, it means a lot. It means a lot to me. I had even non ALS issues. I know I have a whole team of people. If I have something in my family,
Hmm.
healthcare related, I can always at least go to an initial ask and they can kind of direct me, whether it's our team or our clinics, because I'm sure you talk with basically all of our clinics so they can connect about these things, right? So that connection between you and any of our clinic team, the directors, the doctors, neurologists, they know they can reach out to you as well as they're expert on all of these home modification issues.
Correct. So locally, I cover eastern Pennsylvania, central and southern New Jersey, and all of Delaware. And then if you're outside that area and you would like help, you could get it through my website, because I do private consulting too for ALS families, and it's AL it golly gee whiz. It is alsathome.com.
And so one other thing I was thinking of when it comes to these home modifications, we provide ramping or we assist people with the different tools in their home. Those people may not need those tools for long, whether they have a person with ALS who moves to a long-term care facility, or they've moved altogether, or unfortunately the person has passed. The benefits that we provide, they don't end there though, right? Because those people donate them back, or there's other ways that we connect with them to help other people.
Correct. And we also have a really good, vibrant Facebook durable medical equipment exchange page. And you can look for ALS United. equipment exchange page. We have people who want to sell their accessible vehicle, or they want to give away a hospital bed, or they want to donate an eye gaze device to another family. We have over 750 members in that group. And it's also can be used as I'm in search of. So sometimes
Mhm.
yet I need, a seat lift recliner. Well, unfortunately, that's not something we keep in our loaner closet. But literally, I tell people go to the website, and within a day or two, they've made a connection. It's amazing because most ALS families want to give good equipment to other ALS families, and this is a good way for them to do so.
And so after they have contacted you, what are some of the most important questions you think a person with ALS or their caregiver should ask you? Are there things that you think are important conversation starters from their end?
Well, I think it's unfortunately it's about finances. Um,
Mm-hmm.
so if you are considering doing any kind of structural modification, think about that. How much is that going to cost me? But then think about, do you need to hire care? Because some of my families will say, well, I can hire, an aide for $10 an hour. Unfortunately, that's not true. All right. If you go through an agency, you're looking at $45 to $50 an hour, and most agencies will only do 4-hour blocks. They're
Mm-hmm.
not going to come for an hour. So, one of the things you have to think about is what is my hard line? Meaning, when I get to a certain part of the disease, what don't I want my caregivers to do for me anymore? And that's
Mm-hmm.
when you hire care. But then you have to have planned, because that care, hiring care and paying for care, not something an insurance does either. So you have to think about that. So if you're going to hire care and it's going to cost you $20,000, but your bathroom is going to cost you $20,000 and you only have $20,000 to spend, where do you want to spend your money?
Yeah. And you mentioned about what the caregiver wants, what the patient wants. Sometimes there are very sensitive conversations where the patient from our support groups has things they don't necessarily want to talk about with their caregiver there, and vice versa, like out of love. Like they may say, they want to do this for me, and I don't want that, or the caregiver may say they're not going to advocate for themselves. How do you handle that? Where like if I went and my wife had ALS, and thankfully she doesn't, but you may talk to each of us individually to make sure that you're sensitive to those issues.
Absolutely. And then I would also involve my colleagues. I would get our social worker or our mental health nurse involved because I believe that the best treatment that we can offer for this disease is team, is being
Mm-hmm.
a team. And I'm not an expert in mental health. I'm not an expert in for example, somebody who is past and grieving, but I might send them to somebody that I can recommend. So yes, I might meet with them separately. There are times where I'll say, would you like me to discuss this? I don't automatically talk about bathroom issues and toileting unless I ask permission. I can't
Mm-hmm.
just assume that they want to talk about something that intimate.
Mm-hmm. Yeah, and that's an important thing maybe to focus on here is mental health and accessibility. You talked about the connection through social media, and that's really important and wasn't around when you first started here,
No.
really for the first half of the time you've been here, right?
Right.
Considering how recent so much of it is. How important is home modification to mental health for both the patient and the caregiver? And you say you have those conversations. So if you talk with Gail Houseman or some other people on our team, what are some of the thinking you go into when it comes to how your assistants will help with their mental health?
Yeah, I think it is mentally challenging for a caregiver to watch their loved one do something unsafe, and they
Hmm.
do it all the time. It's mentally challenging for the caregiver to, say, stop doing that. You can't walk like that, or you're tripping on this rug all the time. I have to take the rug up, and the person's like, no. Um, and sometimes I think it's more taxing on the caregiver. Um,
Hmm.
and it can be more physically challenging to the caregiver when they have to do transfers and instead of using a Hoyer lift because the person with ALS doesn't want to use it, and then they want the caregiver to lift them up. Um, and so our caregivers get tired a lot when devices aren't utilized because the person is resistant to it.
Hmm. Yeah, I'm sure we talk about how we provide help for over 1,200 people living with ALS in our area every year, and that number may be underestimating it by a bit. But even if it's just those 1,200 people, that really is like 3,000 or more people, because in every person with ALS we care for, you're also considering their spouse and other caregivers in their lives. I was with a person with ALS this week. They were talking about their son, who is 13 years old. So that's a caregiver in a lot of respects. So you're thinking of the whole family. So your work is not for 1,200 people with ALS. It's really for thousands of people impacted by this disease.
That's correct. It's correct. And I think October I started a TikTok page. I
Hmm.
don't have many videos up there, but the majority have been viewed 500, 1,000 times because there are generational differences of the way people learn now and get information. And Pew did a study a few years ago that people take to social media, to YouTube and TikTok, over 54% to learn something new. And ALS is new to everyone. So
Hmm.
they're going to utilize what's out there. And you encouraged me to do my TikTok page, which mostly is home modifications right now. Um, and people are responding. And I also have I put all those videos on YouTube though, folks. I'm ALS AT Maven on both areas. Uh, so yeah, it's not just the person with ALS that I'm working with. I'm their adult child might be in Texas or California, and so when I do these virtual visits, people from all over can join us. I encourage families to have as many people as they want on the Zoom or the FaceTime. And I think especially adult children that don't live near their parent that might have this disease, they want to help, but they don't know how to help. So if they are part of my conversation with them, they will have the documentation to say, okay, Dad, this is the next step in making the house safe.
Yeah, we just had a story last year where there was a great person who had ALS, and his name's Andrew, and his daughter was getting married in Texas. That's where she lives, and he went down there, and everything went really well. But I know that his daughter could have relied on you and our services to understand what they could do to make her house or the living situation easy for when he came to visit. And so those
Yeah.
resources, there's not a wall here where you go outside, you're in Maryland or Virginia or Spain or wherever, you'll be able to learn directly from what you have to offer.
Yes, and we do try. If you are, for example, going to Florida for vacation, I mean, we do try to connect you to maybe somebody that works for ALS in Florida that they could maybe help you find a local vendor to do XYZ. So the ALS community, we try to take care of ourselves, but each other. So yeah, we could certainly facilitate if somebody is traveling, we can certainly try to help them.
Wonderful. I really appreciate all the help you've provided, because I've heard so much good feedback over my time here. I know you have too. It means a lot to all of us that care to see that it's making a difference, that it's not just writing a check or sending someone to a website link. It's a real person providing real help. And because you're that real person, you mentioned about the YouTube page and your other website. If people are interested in connecting with you, what's the best way that they can ask you questions?
Email, and it's
And that
Alisa,
is.
ALISA at alsmidatlantic.org.
Mhm.
Um, and they can also, obviously, I'm on all the socials. They can just Google me and find
Yep.
me on the socials. Uh, so any whatever means that they are comfortable using.
Well, I really appreciate it, Elisa. And again, hope that people will sign up to hear Alisa speak with Kim Crowder and many other specialists at our Help and Hope event on Thursday, May 10th in King of Prussia, Pennsylvania. You can learn more at alsmidatlantic.org and go to our calendar of events. And you can obviously connect with Alisa at alsmidatlantic.org or find all of our care team wherever you are here in our area in Pennsylvania, New Jersey, and Delaware. Or even if you're beyond our territory and just want to ask and connect, they're here for you if you're living with ALS or impacted by this disease.
And one of the things I want to mention also, because you were talking about getting a human being every time you call, our services are offered free of charge to anyone diagnosed in our service area. And that again, I mean, having access to all these professionals, we don't charge you, we don't bill your insurance. We are here for you, as our old social worker used to say, on the journey that you never wanted to be on.
Yeah. I think one of the best validations of our organization and about the team we have here is knowing people who have an ALS diagnosis who moved to our area because they knew they could get better help living here. And I don't want to disparage anyone in the country. There's really great ALS organizations around the country, but when you know people pick up and they choose to live in this area because they can connect with someone like you, that's a really good sign that we're doing a good job.
Yeah. Absolutely. Well, thank you so much for this opportunity.
And thank you for everyone listening. Please subscribe on YouTube or where you find your podcasts. And again, you can email me if you want to learn more about communication and sharing your story at tony@alsmidatlantic.org, and visit alsmidatlantic.org for all of your ALS needs in Pennsylvania, New Jersey, and Delaware. Thank you so much, Alisa.
Thank you.